Start.
Okay, good evening.
Good evening, doctor.
I'm Dr. Iman, one of the children doctor working here. I believe I'm speaking to mother of Adam. Am I right?
Yes, doctor.
Okay. May I know your name, please?
Yeah, my name is Jessica.
Okay, Miss Jessica. Thank you for coming today to discuss about Adam condition. Okay, Miss Jessica, I can understand from GB letter that Adam no case of asthma having lots of exacerbation. Can you tell me more about this?
Yes, doctor. Adam, since past few months, Adam is not doing well. He had several episodes of cough. We went to GP couple of times, and GP doctor also give us the medicine inhaled, meter dose inhaler, Flixotide, and I noticed like I went almost like more than 2 times, 3 times than what his condition was there 1 year ago.
Okay, I'm sorry to hear that. Can you tell me more what happened exactly? I mean that in terms of his condition, is he having cough? What his symptoms that mandate to go to GB?
Yeah, actually, right now, Adam is himself, he's taking this medicine. He's using this device by himself. Previously, I used to keep eyes on him. I used to monitor him. I don't know whether he's taking, not taking properly. I really don't know the reason why he is having more cough these days.
Okay. Adam is there. Can I include Adam or? Uh, Sorry, Adam is there. Can I include Adam in my history of sometimes or only mother?
Yeah, Adam is here. Yes.
Okay, Adam, how are you?
Yes, I am fine, doctor.
Okay, thank you, Adam, for coming today to discuss some issue. Adam, can you tell me more? How many times did you use this Fixotide inhaler?
Yes, I'm using 2 times in a day.
Okay, that is good. Okay, all the day you take it.
Yes. I'm taking it. But couple of days, doctor, we have changed our home recently, and sometimes I'm forgetting also.
Okay, how many times did you forget this in a
I don't
week?
know exactly, but last week I forgot, I think 3 times.
Okay, last week. And this forgetfulness, when did it started to forget this? From the beginning
Yes,
of
yeah, we
taking
changed
the
our
medication.
home just 4 months ago, and after that, I'm still new to our new house. I'm not a bit comfortable, so I don't know. Sometimes I try to remember, and I am getting forgetting it.
Okay, so you forget taking your medication regularly since you came to the new home. Is
Yes,
that
yes,
right? Yes,
yeah.
okay. And since this also lots of symptoms occur also after you come this new house, right?
Yes, yes.
Okay. Can you, Adam, can you tell me how to use your inhaler?
Yes, doctor, I am using this since past almost 5 years, and I know very well how to use this.
Okay, that's good, Adam. That's good. Miss Rebecca, did Adam has any chronic condition other than asthma?
Yeah, sometimes he has some
Sorry, I'm not
he
hearing
has
you
some
well.
skin on the hands and feet.
Sorry.
He has some eczema on the hand and feet.
Oh, okay, I'm sorry to hear that. Did he has any other symptoms like abnormal movement or weakness in his side of the body?
No, no, doctor.
Did he has any shortness of breathing?
Yeah, shortness of breath he has sometimes when he plays like soccer ball. At that time he has some shortness of breath. Also, sometimes early morning also he develops some shortness of breath.
Okay, I'm sorry to hear that. And did he has bluish discoloration of his lips?
No, I haven't noticed that.
Okay, okay. Did he has tell me about his bowel habit?
Yeah, bowel habit is normal. No issue with that.
Okay. And what about his tummy size?
Is also fine.
Okay. He has any other skin spot other than eczema that he has?
Mm, no, sometimes he got a hay fever
Okay.
during spring, but otherwise it's fine.
Okay, okay, that's good. And what about his appetite?
It is good.
Okay. And what about his weight?
His weight is also good, doctor. He's on 50th centile in the growth chart.
Okay, okay. And what about his daily activity? Any recent changes?
Yeah, recently he has limited his sports activity before he used to play in the evening. Recently, it has become less.
Okay. And sorry, sorry.
Just continue, no problem.
Want to take some break? Okay, no problem.
You can pause the time.
Yeah, yeah, paused already.
Ninth centile, 50 centile.
Yes, 50 centile.
Okay. Um, uh, um, Miss, I forget the name actually. How at what age Adam diagnosed having asthma?
Yeah, Adam was diagnosed when he was 5 year old.
Okay. And by whom?
During that time, he had a lot of cough and he was having difficulty in breathing. So before initially referred by GP, and so we came to the region's hospital, and the pediatrician here diagnosed asthma.
Okay. Did he admitted to any ICU or HDU?
Yes, one time he was admitted to HDU.
Oh, not at the diagnosis. And what medication did he receive?
He received IV aminophylline, hydrocortisone, magnesium sulfate.
Okay, okay. And after discharge? as I come to know, only salbutamol and fixotide. Is that right?
Yes, yes, yes.
Okay. And now is he using any tablet?
Now he's not using any tablet. He's just using this two uh, inhaler.
10 minutes done.
Okay. Okay. And what investigation done for to be diagnosed at that time?
At that time, they did some X-ray and they checked quick flow, and they took some note of some questions, and they did also some couple of blood tests.
Okay. Okay. Did he done any operation?
No,
Did he receive any blood transfusion?
no.
Did he follow with any other team?
Sorry.
Did he follow with any other team?
Yes, we are following with the allergic doctor, child doctor, and yeah, that's all.
Okay. Did he has allergy to any medication?
Yes, he has allergy to penicillin.
Okay. Did he has any allergy to any food?
Yes, he has allergy with the eggs and peanuts and cashew.
Okay. And did he has from time to time any symptoms like runny eye, watery eyes, runny nose?
Yeah, when he was small, he has many episodes of cough and cold and watery eyes. But we used to go to GP and he used to give some medicine for the flu, and he used to become okay.
Okay, that is good. Does Adam started his puberty or not yet?
What?
Does Adam started his puberty?
No, no. He's 12 years. No,
Okay, okay. During pregnancy and after pregnancy, anything that concern you?
no, doctor.
Okay, is he development like his beard?
Yes, development is fine.
Okay, that is good. Can you describe for me your home, please?
Yes, previously we used to stay in an old house, was having a four bedroom. Now we moved to two bedroom apartment, and there is some the new construction is going on besides new apartment. A lot of dust is there, a lot of noisy. I don't like a new apartment.
Okay, okay, okay. And what type of floor of your home?
I'm staying on the ground floor.
Sorry?
Ground floor.
Okay. Anyone smoking in the home?
Yes, yes. Adam's father smokes.
In or outside the home?
Sometimes in, but invariably most of the time out.
Okay, okay. And can you describe for me your family, please?
Yeah, Adam has one sister also. 6 years old.
Does he has any chronic condition?
No, she is fine.
Okay, and what take care of her when you are busy with Adam?
I'm the one usually taking care. We don't have any maid.
Okay, okay. Did you have any other chronic condition in family, especially asthma or eczema?
Yes, Adam's grandfather had asthma and also he had eczema. He had a
Yeah.
blood pressure also.
Okay, okay. Uh, what's the impact of the disease on Adam?
Adam nowadays not feeling good, especially after we moved to this house.
Time's
He's
up.
not much interested in playing as usually he used to enjoy his play in the evening. Time finish?
Time finish. History time finished. Discussion.
Okay.
Do you
Okay.
want to continue? I'll pause the time. Then 2 minutes, 1 minute. You can take more.
Yeah, 1 minute. I give yes.
Let's complete it.
Okay.
Continue.
And what about the school performance of Adam? Did he attend school regularly?
Yes, he before he used to attend the school regularly, and nowadays he's missing some of the school day because of severe cough in the morning.
Okay, I'm sorry to hear that. And what about his performance?
Yeah, his performance is fine. He's a bright student.
Okay. Does he has any plan in his school?
Any plan to?
Any plan of management in the school?
Yeah, she's fully aware about this, and generally she is helping Adam.
Okay, that is good. Okay, I would like to present my case. Today I took history from Adam mother. Adam is 12-year-old. No case of asthma, complaining of many exacerbation in the last 3 months because of most probably of moving to new house with lots of construction, and he also missing his corticosteroid inhaler many times in the week. Also his father is a smoker. He also having eczema and family history of asthma. This condition affect his attendance to the school.
Mhm. Okay, so what are your differential diagnosis here?
Okay, my differential diagnosis is that uncontrolled asthma because of non-compliance of steroid because of triggers like smoking and new home. Um, other differential uh, um, mm, maybe another diagnosis which is most unlikely.
Okay. So what you will do with this child, how you are going to manage?
Okay, first of all, the management is mostly by education and education to Adam and his parent about regular intake of steroid, and after that, and about smoking, and also about they trying to avoid these triggers, and after that follow up, and if needed to adjust the dose of his inhaler.
Okay. So what investigation would you like to do in this case?
Okay, after completion of history and physical examination, most probably no investigation needed at the time, except maybe I will see to the his diary of flow meter. This it will be better.
Okay. All right. So what are the main issue did you notice in this history?
The main issue is that this exacerbation is mostly due to the moving to new home with lots of construction, and because of also of maybe smoking and the affection of this in his schooling, school attendance.
Okay. Okay. So Very good attempt, Dr. Iman. It was good, even though there was a disturbance,
Yes,
continuous.
I'm distracted. I'm a lot of
Yeah,
distraction, and this is the second time really to practice. This is
but
second
really,
time.
still, despite of this, you did very good.
Okay, thank you very much for.
And you uh, find out the problem. That is the main thing, which you did very good. You found out the what were the underlying issues, and also about the management. You give correct impression. No need for the investigation. And like you said, after reviewing the big flow diary and after reviewing the history and doing physical examination, you will decide, which is really good answer. Okay. Now, some of the things which you did not ask, like that, I will just mention. Um, you started directly from the asthma, but like whenever this type of scenario, like you start with the general well-being, I think you have to ask in the beginning, like describe your problem in detail, like what kind of cough, dry cough, productive cough, okay, shortness of breath. So how it happens with exertion, without exertion, what time is the more cough? Is it in the night? Is it in the day? Is there something which aggravates his cough? Is there something which relieves his cough? So that history in the chief complaint, it was not there. That I noticed, like relieving the a little bit more analyzing of the chief complaint, which was slightly less in this. Then uh, immunization. Did you ask immunization?
No, no, missed immunization.
Immunization you did not ask. And about the like any pet in the house, or is he visiting to any, like here, I give you
Yes,
clear cut, like okay, I am moving house, changing. But generally, like when we do practice with other people, they don't come out with this. They will not give you this information until unless you ask. Till the end, you will keep on searching why. And the last I will say the house, I moved house. This also happens. So to get that, you need to ask, is there any pet? Okay, is he visiting to any other like grandma's house or grandfather house? Do they have any pets? Any like are you using a carpet at home? Sometimes carpet also causes a lot of this, fur and all this. It can cause some pollen and allergic cough. After that, uh, in review about like you ask me weight, diet, and that is okay. School you came very late, and you like ask me about the performance in the school and dropping of school. That was in the extra minute. You came very late. Also, you ask how he's coping, but also you need to ask like how's the family is coping with this situation. What is the most worrying to the mother about this is also important. And regarding financial support, also I think you missed. You did not ask about the any support system, any financial support. Yeah, and some of the irrelevant question about the puberty and all you asked. I think 12 years early for puberty in the boys. But anyway, that is not a major concern. About operation, surgery, and all you asked me about the follow up also, and just like about the past history, like when diagnosed. You asked me, I think about HDU admission, how it was diagnosed, what investigation done. That was good part. You that too also I feel that you will come immediately after the acute complaint, but you came slightly late onto that part. That make you again rush on the other part. So other than that, it was completely fine. Any other people, other members give the feedback to Dr. Iman?
Yeah, yeah, you are rightly said that that cheap complaint should have been asked and explored in more detail. Actually, that is the main thing here.
Yeah.
Asking the cheap complaints. Maybe actually she was too much
Yes,
distracted
yes,
because of
yes.
sleep.
That's why. But
That is
What was the
the
chief
reason here.
complaint, Dr. Hiren? What was the chief complaint?
Like,
this case, like
recurrent exacerbation of his asthma, but we should ask what is his what are his current symptoms.
recurrent cough
Yes.
and exacerbation, and
Yeah.
GP has referred like he's needing more and more refill, and his
Mm.
asthma is not in control.
Okay.
Also, like
So this
that's one of the
uncontrolled
important question.
asthma, we have to actually first exclude. We have to explore the cause. Like, is it
Mm.
really asthma diagnosis or some other diagnosis? How much the cough? Is there any
Yeah.
sputum? Is there any GIT symptom? Because sometimes
Yes,
patient diagnosed as asthma, but actually the case is cystic fibrosis or
right.
Cartagena, something like
Like
that.
we asked GI symptoms. GI symptoms she asked.
GI she asked.
Yes, and this cough, how many is there any sputum? Elaboration of the presenting complaint. This is very important.
Right.
Anything like
Right.
abdominal pain, headache, joint pain. Elaborate. Socrates for pain. The mnemonic is Socrates, and for other like cough, aggravating factor, relieving factor. Yes, these things are important. And at first, when we start, we will start like this. Hello, how may I address you, or how may I call you? Okay, because the child's name is there, Adam, but the mother's name was not there. So hello, good morning or good evening. How may I address you? So she will say like, you can call me Mrs. Jessica or you can call me Miss Jessica. This address is very important. Anything like history, communication, development, anything. How may I call you? Address you.
Yeah.
Also, like I peak flow diary. I think she forgot to ask. She knows
No, no,
that
she
the peak
said.
flow diary.
She
She
said
said.
diary. She said,
No, she
yes, she
said.
Peak
said.
flow diary. Also, how many the courses of oral steroids received in last 6 months? That is also
Steroid
important.
diary. Yes, not only peak flow diary,
How many
steroid diary.
courses of oral
Yes.
steroids?
Attack diary. Did Iman ask about the development growth? Because read book. How old is he? 12 years? How old?
50th centile. He
12
actually
years.
asked about weight.
She asked regarding puberty. She asked regarding puberty. Whether he
Puberty.
has
Yes.
gone into
Puberty
puberty.
growth chart. Yes. Read book. Is there any fallen growth? Is there any
Fever. She
fallen?
asked fever.
No, no, general complaint, like general being like any fever, any what is the quality of cough and all. That she did not ask.
Mm-hmm.
Elaboration of chief complaint includes general well-being.
Mm.
It was not there.
Here, actually, most important thing here are like exploring the current complaints, exploring the compliance, who gives, how takes, how many doses missed, maintaining of the peak flow diary, and social history and immunization history. These four parts are very important. Other things we can just touch quickly. Social history means of what is the house recently changed, then carpeted, non-carpeted, windows, ventilation, smoking in the family. Social history, how the child is coping, how family is coping. Drug history, what drug is taking, how many drugs he is taking, regularly, not or regularly or not taking regularly, any drug missing any drugs, maintaining the diary. These things are important here, not to forget.
Here, flu vaccine is
Right.
And a
especially
vaccination, flu and pneumonia vaccine categorically we have to ask.
yes.
So it was good
Yes,
attempt
flu vaccine
in
and
spite of so much disturbance. Rayman, nice. Uh, I will post for the next meeting in 2 3 days.
Dr. Sandeep, just discuss 5 to 10 minutes about the extended clinical, how that station will be. I'm very much, actually, I don't know how the station will be.
Dr. Tamanna, actually problem like we don't have any idea about it. Right? As of now, there is no explanation by anyone. Once they,
I'm telling you, in our FCPS,
hmm,
Bangladesh, we had same station, okay,
hmm,
extended clinical. And how was
hmm,
the station? I'm telling you.
hmm,
First, they will give you one patient of suppose abdomen or MSK, okay.
hmm,
Then you will do as 6 minute, like we do for every station, clinical station, 6 minute exam, okay. Suppose there is a hepatomegaly. They will give you a patient. They will give you a picture of patient video, and the examiner will palpate and say, okay, there is 4 centimeter hepatomegaly. Now, how you will proceed? So you will tell like, sir, I want to see other organs like spleen. Is there any spleen? No. I want to see lymph nodes. Is there any lymph nodes? No. I want to do general examination like pallor clubbing, like everything. So you will finish the exam 6 minutes. Then examiner will come and there will be 9 minute discussion. 9 minute, yes, 9 minute minimum. There can be more discussion because it is extended clinical and it is 23 minutes. Actually, it is 23-minute discussion. So I think it will be more, discussion will be more. So examiner will ask you that, okay, so how you will take history from this patient. So this is a case of suppose only hepatomegaly. So what are the causes of only hepatomegaly? The history should be on that. Okay. And then examiner will go to the that according to the according to the examination and history. What is your provisional diagnosis? Suppose it is a case of what will I say? Thalassemia. Thalassemia is hepatosplenomegaly. What will I say? Only hepatomegaly is suppose glycogen storage disease. Okay, it is only hepatomegaly. And then examiner will say, okay, so what is other differential diagnosis? You will tell 2 to 3 differential. And then the examiner will say, okay, what is your management plan? So for management, I will take detailed history so that you take, and
hmm,
I will do detailed general examination, other system also. Okay. And then I will do some investigation like ultrasound, like blood glucose, if it is a glycogen storage disease, like enzyme level. Okay. Then I will go for management, treatment purpose. So what is the treatment of glycogen storage disease? Like this. This was the same station in our FCPS, but the time was a little bit more. That examination time was 9 minutes. Now, in our MRCPCH, how many times they will give us for examination? I think they will give more time because it is extended clinical. So they will give me, I think, some more than 6 minutes. They will give 6 minutes is not normal station, normal like CVS, CNS, 6 minutes. But for this, I think they will give us 9 minutes or something more. Okay. So if this is the protocol, then it is known to me. Actually, I am accustomed with this
then you
protocol.
know, like what are the timing distribution in this?
Yes. What will be the timing distribution? This is my question. I think physical examination here is a little bit more than the other system, than the other station. Other station is same. Like there are previously there were 4 clinical station. Now there will be 3. 2 clinical station is same. One clinical station that is extended 23 minutes.
Yeah,
Now 23 minutes, how I will divide? They will tell, of course, they will give the agenda, they will give the time frame, of course.
they are
No,
making.
but this
They will be making some
extended
videos. After that, we will come to know exactly.
Hmm. Right.
Till that time, we will
after
do
this
all guesswork.
history, there is a history and the discussion followed by history is only 2 minutes, in the extended, like 10
Oh,
minutes history.